Hello friends, I am Dr. Harendra Thakker. I am a consultant in pulmonary and critical care medicine, practicing since last 22 years in field of this medical practice. In Shalby Hospital, we have a very advanced pulmonary and critical care department where we have all kind of facilities to evaluate, to diagnose and to manage the patient with all kinds of respiratory problems. To start with, we do have primary asthma and allergy clinic where we are testing for the all kinds of allergy with the skin prick test, and accordingly we do treat them for desensitization and anti-allergy treatment. Secondly, we do have a routine respiratory ailment clinics where we are evaluating all the patients with TB, COPD, pneumonia, common cough, cold, and we are diagnosis with routine X-ray chest, blood test and CT scan, and accordingly we are treating the patient. Third thing, we have advanced interventional pulmonology department where we have facility of all kinds of diagnostic and therapeutic bronchoscopy. All patients with undiagnosed pneumonia, undiagnosed respiratory problems, we do evaluate with the routine bronchoscopy and diagnose according to the laboratory diagnosis. Patients who suffer from chronic pleural diseases, empyema, pleural effusions and mesotheliomas, undiagnosed pleural diseases, we have facility of thoracoscopy where we are looking inside the pleural cavities, we are taking biopsies and offer the good diagnosis and treatment. Fourthly, we do have an advanced sleep laboratory where patients with all kinds of sleep disorders and sleep apneas, we are diagnosing them with the polysomnography and CPAP titration for treatment of the obstructive sleep apnea. Fifthly, for children and adults, we are running a vaccination clinic where routinely flu and pneumonia vaccinations we are giving on a yearly basis. For specialized pulmonary problems and orphan lung diseases, we do have a special clinics on a weekly basis where we are running special clinic for interstitial lung disease, where all patients with the undiagnosed interstitial lung disease and undiagnosed lung problems, we are specially attending the clinic and diagnose the patient. Secondly, patients with advanced lung disease or unknown pulmonary hypertension, we are running a special clinic of pulmonary hypertension where in joint consultation with the cardiologist, we are evaluating the patient and diagnosing the cause and root cause of the pulmonary hypertension. Thirdly, for the patients with the advanced chronic obstructive airway disease like COPD and asthma, we have advanced lung function tests where we are doing all lung capacities and lung diffusion studies and advising according to them. And lastly, for the smokers and heavy smokers, with joint conjunction and consultation with the psychologists and psychotherapists, we are having a quit smoking clinic where we are advising and counseling the patients to quit the smoking. Friends, please do visit to Shalby Hospital, visit to our pulmonary department, evaluate your lung functions and keep your lungs healthy. In today's era, with the heavy pollution, it is advisable to check your lung functions on a yearly basis. Thank you.